Okay, well, in the since it's 7:01, I want to make sure that we get started on time. I prefer rewarding everybody that's showing up on time to obviously allow you to get done with the presentation as quickly as possible. And my name is Christian. I'm the owner of Foot Solutions here in Kitsilano, and I'm a certified podorthist. And thank you for Susan and Pauline for inviting me to speak to you guys tonight. I really appreciate the opportunity to present to you. Now, whether or not some of these things, I think a lot of you already know. I do work with a few foot care nurses quite closely here in Vancouver, and as a result, I have an understanding as to what you already know. But at the same time, wanted to touch base on a few different things that I thought might be of value to you guys. And if you have any questions regarding anything during the presentation, please feel free to interrupt. You can unmute yourself and ask me a question anytime. Or obviously, if you're unmuted, just feel free to just chime in at your leisure and go over whatever question you have. Now, today I wanted to touch on a few things. Number one, shoes. Number two, orthotics, and then also we have a bunch of ready-made products available to help prevent obviously corns and calluses and black toenails, as well as diabetic complications, which I think is something that you work with quite frequently. At least Pauline and Irina, who I work with quite often, that's pretty much what they work on all the time is calluses and corns. But wanted to kind of talk about a few things with regards to shoes, as to how you can also help clients, kind of improve their fit, and then potentially help them also understand, how to choose better footwear for themselves. Okay, let's go to the next slide here. Let's see, there we go. Perfect, footwear lasts. Everybody is probably familiar with the footwear lasts. Now it's usually used to be a piece of wood. Nowadays, those are mostly made out of plastic, some rigid plastic components, and that's what they take the leathers and also the mesh materials from running shoes and wrap them around to create the shape of the shoe that you see on the wall of the shoe stores. Now, every last is obviously unique. In many cases, for many companies, that's something that you don't want to give up very readily, just because of the fact that that's a particular fit that is only available to that brand, and they don't necessarily want to give that away to somebody else. But at the same time, depending on how the last is designed, a dress shoe last is going to be very different from a running shoe last, and there's different types of lasts that I wanted to touch on today, because those can make a difference in terms of how much pressure there's on the foot, as well as what's maybe potentially irritating the foot. So here we have more of a curved last. These are all running shoe examples, and this particular pair here, you can see on the outer edge. I don't know, can you see my mouse here, Catherine?
Yeah, we can.
Okay, awesome. I wasn't sure if that was going to work, but with the outer edge right here, usually with a curved last, that usually means that the material on this side, there's a little bit more of it than there's on the outside. And as a result, it oftentimes puts a lot of pressure on the little toe. And that's where I see a lot of times corns and calluses develop, obviously on that's edge of the toe, right? And with the curved last, it's something that's very popular. Many of the brands will use it. It's more of a fashion reason than it is a comfort reason, because it makes the shoe look sleeker and obviously nicer on the foot. But at the same time, it can create a lot of irritations. Now, a lot of times when clients come in and they have issues with that, if they want to have a curved last shoe, because that's kind of the look that they're after, I usually recommend going up maybe a half size or a size, just to improve the amount of space that you can create on this side, so that the curve that you see right here doesn't come in so early, and therefore it doesn't squeeze the toe over as much, right? So that's one thing I would recommend. With a curved last shoe. Obviously, if they need more space or have wide feet, the straight last is usually better. That's for the foot that has that bulkier feel. Most of the time, these also have more depth to them, so that means that the room, and I'll show you on the shoe. Can you see my screen here? I'm not sure, it might be a bit small, but the depth is this part right here. Which in some cases will be a little bit roomier for a wider fitting shoe, or somebody with a high instep or maybe a high arch, and they tend to do better on a straight lasted shoe as well, because especially when they have a high arch, they have a tendency to supinate, which means they're walking on the outside of the shoe, and as a result we want to have more support along this edge right here, which is the outer edge of the shoe, to make sure that the person is well supported and does not, potentially twist an ankle or put strain on the peroneal tendons on the outer side of the foot right here. So that's kind of the difference between the straight and the curved blast shoe. So one of the things that I stress in our store is obviously we want to measure the feet, and I think a lot of times people haven't measured their feet probably since they were 16 or 17 years old when they started to make their own shoe buying decisions. And one of these items is obviously the Brannock device, which has been around for a long time, and it allows us to create a better fit and really have an understanding as to what size the client has to go into. So I highly recommend people kind of familiarize themselves with the Brannock device and how it works, so that when they go into a shoe store, they can at least use it themselves. I just recently shot a video with a local videographer just to explain how to use a Brannock device, so people can actually use these themselves when they find them in Sport Check, stuffed away somewhere underneath the chairs. But that allows them to just kind of get a better fit. And one of the things I also recommend is you can see the foot right here with the insole is most running shoes nowadays have removable insoles. So you can take the insoles out and obviously put your foot on top of it, which is why I wanted to indicate this, because this allows you to kind of figure out whether or not there's enough space in the shoe, number one. And that's usually should be about a finger width of space at the end. So you want to have about a finger width of space here to make sure that there's enough room inside the footwear to prevent any kind of rubbing at the end of the toes. And that's what oftentimes will cause those black toenails, is because the shoes are too short. And I'm sure you're familiar with that. Those are some things that I recommend to check for the length of the shoe. It also allows you to check for the width of the shoe, because if the foot is overlapping over the edges of the insole, then the client can fairly easily know that they have to either choose a wider shoe, a different last of shoe, or potentially go with a totally different brand altogether, just because of the fact that, if the foot is overlapping, it's going to cause a whole bunch of different problems like ingrown nails, corns, and then potentially black toenails as a result. And then obviously there's the rocker soled shoes, or the depth of the shoe that I really wanted to address here is that, it's not just the width of the shoe that's important, it's also the depth of the shoe that's important, depending on the type of foot that we're working with. And then you want to have a shoe that has a strong heel counter. For somebody that has balance issues, we want to have something that's really firm back here. So when you're squeezing the heel counter together, you don't want to be able to have the two sides touch each other, because that's going to cause the foot to not have good, not great stability. At the same time, you want it to be somewhat flexible in the forefoot, for the average user. Or if you have somebody that has a really, really rigid toe, that's, a hallux rigidus, then you want to have something like the Hoka here, which I have displayed, that has more of a rocker profile. And that rocker profile right here is going to allow them to step forward without having to bend their toe. And that's going to reduce pain for them in the feet as well. So that's kind of my shoe fitting 101. Now, when it comes to orthotic design and manufacturing, one of the things that we like to discuss here is, just as different top cover materials. I'm not sure what you guys see on orthotics frequently, but if you work with a lot of diabetic patients, you probably have seen a lot of the plastizote materials. That's kind of a pinkish color, kind of what you see on this image right there. And it has the properties of, it has the ability to actually heat mold to the foot, and over time also pressure mold to it. So as a client is stepping on it, it's going to create, little impressions of the foot on top of the material, which means that if they have a callus, let's say under the first metatarsal joint, or maybe they have a callus under the third metatarsal joint, as you can see on this image here, there's little depressions for that as well. But if you put a plastizote material on there, it's going to kind of mold itself around that callus and create a little pocket for it to sit on, and that's going to help reduce some of the pressure on the bottom of the foot. Now, this also with an orthotic or an arch support, doesn't matter what it is. The purpose of that is obviously to offload the weight on the ball of the foot. Now, I find that's extremely important with clients that have insensate feet. just to make sure that, we have even weight distribution across the bottom of the feet, and take pressure off the metatarsals, especially, because that's going to help, prevent potential pressure ulcers and things like that. And then we can, design them, as you can see in this particular image. It allows us to do computer-aided design, which allows us to modify the orthotic device before we even make it. And then we can carve this out of a block of foam that we can then cover with a top layer afterwards. And the couple of materials that I like to work with is also the Poron, which is this blue material over here. Now, Poron is a very spongy material. It doesn't lose its cushioning very quickly. And therefore, I find it's a really nice material to help reduce stress on the bottom of the feet. Whereas the Plastizote itself is really more of a top cover material we use to, number one, show whether or not there's been any bleeding, potentially. That way the client can check the insole, especially if they have trouble bending down, they can check for bleeding on the insole material because it's a light color. And at the same time, it's going to kind of create its own little impression of the foot on itself to reduce the pressure points in certain areas. We got Diane joining us here as well. Let me admit her too.
Could I just ask a quick question about is it Porion? Is it an adhesive backing? I'm just thinking about someone who maybe plays sports in their senior years and are active, but they have the calluses underneath the metatarsal heads. Would it stick if you put that onto the insole in their shoe?
The Poron itself doesn't have an adhesive backing to it. We usually use glues to stick them together. But I mean, there's some insoles out there that have that material in them already. So you can buy them off the shelf. Poron itself is not usually a material that I would put right on the foot because it tends to disintegrate if there's any kind of friction on it. So it has to be kind of a mid-layer component. We want to make sure that it's on a kind of in the center between the Plastizote to make sure that it doesn't fall apart. And it's really more of a cushion material. Okay. Yeah. Okay. So these are some of the materials that we like to work with orthotics for, especially clients that have issues with pressure points on their feet. Any other questions regarding that?
You would do this mapping within your office there in Vancouver?
Exactly, yeah. Yeah, so we have multiple different systems. We have our Amphit system. We also use a structure sensor, which is an iPad with a 3D scanner on it. So we have that as well. We can do, because I mean, one of the things that we do offer is in-home visits for stuff like this as well for clients that can't necessarily make it to the store. So if they need shoe fitting options or potentially even orthotic design, we can help clients out of their home if they can't make it to the store. So that's one thing that's definitely a great feature. But we also, use a multitude of different tools. In the store, we also have a pressure mapping tool, which allows us to kind of map the pressure on the bottom of the feet. I mean, it's a good visualization, but most of the time when there's pressure points on the foot and there's calluses, we already know that there is pressure points. However, if there's somebody with an insensate foot that, maybe isn't walking a lot and there's no calluses present, we can put them on this pressure mapping tool to figure out where there's high points of pressure and then offload those points of pressure for them with an orthotic or an arch support. Okay, so now I wanted to go here to toe protection. So there's a bunch of different products out there. I mean, some of them you may have seen before. A lot of them are in the Pedifix line. So this one here is the Correct Toes, and that's kind of a toe spreader, which we've been using for some time. It's designed more for toe alignment. So if somebody has, let's say, a valgus deformity in the toe joint, which the joint is going sideways, and the first metatarsal phalangeal joint is popping out. What we try to do here is try to realign that and help straighten out the toes. People can use it, around the house to begin with. It is quite an aggressive tool, so it does take some time for people to get used to it. I wouldn't recommend it for somebody who has really insensate feet. It's really for somebody that has the ability to kind of work on alignment and have some pressure on their toes to line it up. They do come in 4 different sizes for this particular item. And it can help, sometimes even reduce some of the strain on the hammer toes and such as well by kind of pushing it down and keeping the big toe from trying to push that second or third toe out of the way. So that's a pretty neat tool that we have had available for some time. It was developed by a podiatrist out of Portland, and he wanted to basically help people realign their feet through spreaders. Also, and that may be a subject for another time. I also started partnering with a physiotherapist out of Florida, and we've been teaching people how to realign their bunions in a more natural way by working on fascia and doing manual release therapy with different tools to loosen up some of the tissues in the toes and around in the feet themselves to help the toe kind of realign itself through rotational release and pressure releases in those areas that you can do from home. And I've been training people on that as well. But this is kind of more of another tool that you can combine with that therapy, or at the same time you can use it also as a training tool, which has worked quite well for some clients. But I do recommend it mostly for clients that have a very kind of flexible bunion where they can really move it around more easily, whereas the more rigid bunions is going to be quite uncomfortable to try to push it out that far. Toe wraps are for hammer toes, really. This is kind of a new device. It just came out for us. And you can hook a couple toes together to really help them, align a little bit better. And this can, potentially help keep the big toe straight as well. So that's kind of a new device that we have available, and they come in a pack of 2. There's also these little corn protectors. I think you already have probably something like that in your toolbox. But if anybody's looking for something like this and needs some extra added protection for some of the dress shoes potentially, obviously I don't think this is it's more of a temporary solution for short periods of time. I wouldn't recommend wearing this all the time, and that's really just to kind of help relieve some of the stress on the toes themselves. There's these ones here, which are the foam kind of toe spreaders. It's a very, very spongy material, and it really does. You can pretty much just crunch it up in your hand, but it's really great for relieving some stress and friction in between the toes. And we have a lot of clients use that, especially if they have issues with, potentially corns between the toes. If you don't, you may have already access to some of this through some of your suppliers. I know Irina has been using some similar stuff from other suppliers that may be available to you. So maybe a good add-on for your clients if you don't already have something like that in your toolbox. But it's a great way to help soften up, the pressure points in between the toes and prevent that friction. The other option for this is also toe socks. So there's Injinji and there's some Japanese socks, which are basically toe socks that spread all the toes apart, and that can reduce friction in between the toes as well. And that would work very similar to this, but it would be in a sock type form. Although they can be quite tough on the toes. So I would recommend using those not with somebody that has circulation issues, because they may put too much pressure on the toes and it could potentially lead to issues. And then here's another one, which is a toe wrap as well. That's a little bit softer device, and it just kind of hooks 2 toes together. It doesn't necessarily pull them down quite as much as the toe wraps in the middle here, but it just kind of helps to separate the toes and hook them together. And then we have also little devices like this, which are basically what that is. It's a gel spacer for the big toe and the second toe, and it hooks onto the second toe and the big toe to keep it from moving around. So that's something that we use a lot for clients that may want to use a spacer in their sandals. So if you don't have the ability to actually wear your regular spacer in the sandals, this actually will hook on and stay on the foot, and it works really well in that respect. And we've got more stuff here. So that's these guys here, which are, I have a lot of clients that have issues with pressure on the tip of the toenail. So for somebody with black toenails, this can help reduce some of that pressure, especially somebody that's maybe a runner, and really can take some of the pressure off. I mean, obviously, if the shoe is too short, we got to work on that as well. So that's not something that I would recommend for all the time, but I have a few clients that have really tight fitting dress shoes that use this in their dress shoes to take some of the pressure off their nail, and it seems to work for them. Little toe buddy is a spacer for the for the fourth and the fifth toe. So you can see that is kind of separating those two toes. A lot of clients that have kind of the fifth toe going underneath the fourth toe really love this product because it keeps those two toes separated, but not so much that it's really uncomfortable to wear in a shoe. So that's a great product to use in you know, kind of tighter fitting shoes where you don't have as much space, and it really is going to help reduce some of the pressure on those toes and prevent it from rubbing. And then there's a bunion guard here, which is the little toe bunion guard, which is obviously for the fifth metatarsal. There's also one for the big toe that you can get. So there's one for each side, and there's more of a protective product for those areas. So if somebody has sensitivities there, or maybe they have a tailor's bunion that's causing them a lot of pain, this may be an option for them as well. Although you know, this can help separate that too and reduce some of the tension and pressure on the fifth metatarsal. This is another comfort toe wrap. That's really what it does. It protects the hammer toes on top, but it also has a little thicker pad that kind of stuffs into the sulcus rise and in the sulcus crest right there, and it really helps to provide some support there. So if people have, you know, pressure on the tips of the toes, this is an item that they can use to reduce some of that pressure. I mean, I'm sure you've seen calluses right at the tips of the toes. That can be a problem, especially if they have a tendency to kind of claw their toes when they're walking, or maybe they have balance issues, which is causing them to do this. And this is going to help reduce some of that pressure on the tip of the toe to prevent them from grabbing there so hard. And I think that's a good option for somebody with those issues. And then here we have the double toe straightener, which helps to provide some protection and some support under the ball of the foot. So it will provide a little bit of cushioning under the ball of the foot, but also hooks onto the toes. And these are kind of elasticized straps. So you basically wrap them around the toes, and then you pull them down and tight so that it helps to bring down that proximal interphalangeal joint, you know, which is the first joint in the toe, and helps to bring that down so that it prevents you know, the toe from wanting to rise up. Keep in mind that this only works with a flexible hammer toe. So if you have a rigid hammer toe that's kind of stuck in position and you can't actually straighten it when you pull on it, that's not going to work. So you'll have to use that only with you know, flexible hammer toes that can straighten when you're putting pressure on them. And that's really the purpose of the double toe straightener, is to help straighten it out and then provide padding on the ball of the foot, which often is irritated as well because of the toes curling back. You know, the metatarsal bones have a tendency to drop down, and there might be a lot of pressure there. So we try to restore some padding with this particular pad as well. Any questions?
Christian, do you have something for people that have a lot of heel pain? What would you recommend?
For heel pain?
Yes.
Are we talking about plantar fasciitis or just general heel pain?
No, just general heel pain.
General heel pain?
Yeah.
I mean, for general heel pain, sometimes just a gel heel lift can make all the difference. You know, because sometimes certain shoes don't have a lot of padding in them, especially if they wear dress shoes, you know, that don't have a lot of cushioning. And, you know, you can usually pick those up at a regular drugstore as well. You know, there's quite a few. Some items are better than others in terms of the, you know, material composition and how cushy they are. So it really depends. But I find we have some latex heel pads. We also have some, you know, gel heel pads that can make a difference for that. And then the other option is to look at certain brands of shoes. We have brands like Joya or Gravity Defyer, which are two different brands that have a lot of cushioning in the heel. And they provide a lot of shock absorption. So when the client steps down onto the heel, it actually really provides them with, that impact reduction. And what's nice about that particular shoe is that it doesn't necessarily shift the weight forward. The problem is that when you put a heel lift in, it oftentimes will bring your heel up, which also puts you forward onto the ball of the foot more, right? And that can be a problem when it comes to the heel lift itself. And that's where, just maybe using a full length cushion insole might be better. That has some extra shock absorption. And then there's so many different types of heel pain. So for general heel pain, that's what I would recommend. If it's plantar fasciitis induced, obviously we have to look if the foot pronates and the arch collapses. If they have, the heel pain more towards the back of the heel and then up the back of the leg, obviously it could be Achilles tendonitis. So it depends on what's causing it, that we need to make sure that, there's the appropriate measures taken to provide that support.
She's got a very high arch too.
Okay.
So and complains of heel pain, like just heel, not so much her arch, but she does have a high arch too.
Yeah.
So I don't know if that has anything to do with anything.
Yeah, high arches are very prone to heel pain, especially because they don't have very good shock absorption. I mean, high arches, the pes cavus foot is like, okay, let's see, like that, right? Where the flat foot is always totally flat, but it's a poor shock absorber. So usually the padding has to come from either the shoe or it has to come from an insole that has a lot of cushioning.
Right.
And then heel pain is not too off to the side, is it?
No, it's more in the back, like of the heel.
More in the back. Yeah, I mean, sometimes they could suffer from Achilles tendonitis as well, because of the way the pronated foot has a tendency to be in valgus. So
Right.
that means that the ankle is kind of turning in like this, right?
Mm-hmm.
So when you look at it from the back, it looks like the inner ankle bone is turning inwards, right? Whereas with the pes cavus foot, it's the opposite. So they actually have the outer ankle bone turning outwards, and that can still put stress on the Achilles as well. And oftentimes there's tightness in the calf muscle too. So I find, the pes cavus foot is very rigid foot, so it tends to have to do a lot of manual therapy, like stretching of the calf muscle, working on loosening up the muscles in the arch area to make the arch almost drop a little bit and make it become more flexible, because it is just too stiff. And then if she has a lot of issues with that, the other problem with some of the shoes that we have, like Joya, some styles may not work for her because of the fact that they may cause her foot to go outwards more because the shoe is padded all over. Then some other brands might be better. But I think, with cushioning, she can, accomplish a lot of things there. And that will probably take care of it. But if she's used to wearing, dressier shoes, then, she'll have to get used to maybe wearing more of a kind of a running type shoe that has more padding in itself, or look for a heel cup. There's like these gel heel cups. She can probably pick up a lot of drugs and she can stick them in for extra padding, which probably would work. Right. And I would look for something that's silicone, preferably. Some of the gel stuff is, I find some of the gel stuff is still too hard. It doesn't provide a lot of cush. So the silicone stuff is usually more expensive, but it tends to be more padded and it will last longer as well. For cushioning, that is. Yeah.
Mm-hmm.
Sure. Thank you.
Yeah, you're welcome.
You mentioned that you do home visits, or you will travel to the client's home. How far will you go, and is there an additional charge for that?
How far do we go?
Yeah.
We go Vancouver, North Van, and West Van is what we do right now.
Okay.
So we don't really go necessarily outside those borders too much. But usually for home fitting, there's an additional charge of $25 for a home fitting. And then, everything. I mean, if we have to go there 2 times or 3 times, there's no additional charge for that. It's just that one-time fee.
And if someone was to come into the store, they need to book an appointment, or they can just walk in?
At the moment, we by appointment only.
Yeah.
Just because of the situation. Usually we would be walk-in as well, but at the moment we do recommend people making appointments. I mean, they can book them online. So the website you see there, you can book the online appointments there as well. So that way, they can book it whenever they have them in it. Doesn't have to be done through the phone necessarily.
And is the initial consult or assessment, is that complimentary, or is that something that could be billed to third party, or?
No charge for the consultations. Yeah, so in-store consultations is no charge.
Okay.
Yeah, no, we do everything complimentary because we want to make sure that, even like if somebody comes in for a shoe fitting, obviously we're not charging for that because we want to make sure that people get the right product. And then usually that's anywhere from half hour to 45 minutes to make sure we get the individual the right products.
That's great.
So Christian, do you recommend going half an inch bigger? Say if I'm size 9, do you recommend like going size 9.5 if I were to get a new shoe, for example?
Great question. That's really depends on the brand, right?
Okay.
And also depends on, because the thing is that every brand is different, and I can't really say what size you might be in one shoe than the other. It really comes down to just making sure that you've got that finger with the space between the longest toe and the end of the shoe. So it may be the second toe that's longer, or maybe the big toe that's longer. So you want to find out which is the longer toe, and you want to have an extra little bit of space there. And then width-wise, obviously making sure that you have that room across the ball of the foot. So if you go across the ball of the foot in a shoe, and you hear this area right there.
Yeah.
If you're trying to go across that when you have your foot inside a shoe, and you can actually pinch the material, there's too much room in the shoe. So that either the shoe is too wide and you have to try a narrower size, or you have to try a different style depending on what's available, right? But that's kind of the key component there. Also around the heel area right here, like you don't want to have a ton of gaping around the back of the heel, because that's going to cause you to feel like the shoe is too. I mean, number one, it's too sloppy. It's not really going to provide a lot of stability for the ankle. So it has, it has to be nice and snug around the ankle, but you do want to have a little bit of give in the front, so as you go across here, you should feel like the material has a little bit of give and it's not like totally tight on the foot, because then it doesn't really allow any give, and then therefore, it might cause the foot to fall asleep, or maybe you end up with, issues like mortise neuroma because the shoe is too tight. But it shouldn't be so sloppy that your foot is like sliding all over the place, because that's not going to give it a good fit. But really, with the regards to the size, yes, most of the time in most brands we'll go half a size up, and remember that half a size is not half an inch. Like every half size that you go up in a shoe is a 1/8 inch more, right? But the shoe does get a little bit wider across this is what we call the vamp of the shoe right here. So it gets a little bit wider across here, by about a quarter of an inch each half size you go up, but it only increases about 1/8 of an inch each half size, right? So even if you go a full size up, you're only going to be about a quarter inch longer, which is not necessarily a big deal if you need the space, right? And if somebody has a really wide foot and you need extra space, then they have to go into a longer size if they can't find the wider fitting shoe, although it's usually advisable to go into a wider fitting shoe. So New Balance, for example, makes medium, wide, extra wide, and sometimes even 6E. So you can get these really, really wide fitting shoes. And the purpose behind that is that not only does the shoe get wider in the material, oftentimes it also gets wider in the sole, right? Because your foot is not necessarily going to be just wider on top, it's also going to be wider on the bottom. And you want to make sure that that is sitting nicely on the sole of the product, and you're not, standing on the edges of the shoe. Because if you're standing on the edges of this footwear and overlapping, that could potentially cause issues in terms of, calluses and so on and so forth as well, because now you're walking on something harder that the foot is not supposed to be standing on. Does that answer your question?
Yep.
I have a question.
Yep.
Can you hear me?
I can, yeah.
Okay, great, thanks. Christian, I picked up It's called the Brannock device.
Yeah.
Right. I thought it might be a good idea to perhaps incorporate that as part of my assessment. Measure my clients' feet and just make a note of that, and just so they know what the proper size is. How do I read that? How do I read it? I haven't implemented it yet just because I've not known how to use it. Can you kind of give sort of like a kind of the Cliff Notes version?
Yeah, absolutely. I mean, it's not too complicated. It's only really the Brannock has 3 functions.
Yeah.
Right. So it will measure the length of the foot. It will measure the width of the foot, and then it will measure the arch length of the foot. So I don't have one here with me, but let me go back on the slide that I had previously. Just bear with me there.
Yeah, I came in late, so I missed a bunch.
So this is the Brannock over here.
Yeah.
Can you see that now?
Yes, I do.
This little thing on the side will slide side to side, right?
Okay.
And then it also, if you have one that says men's and women's, because obviously sometimes there's a combination where you can have men's and women's on the same device, or in some cases you have a women's only one and you have a men's only one. Now, when you have men's and women's, usually they will have markers on one side for women's sizes and then markers on the other side for men's sizes, right?
Okay.
There's usually about a size difference between the women's and men's sizing. So make sure when you're reading it that you're reading the men's size and you're not reading the women's size, because that can be confusing at times.
Right.
And then usually they have it color coded on each side, which either yellow and blue or whatever else colors they may use.
Okay.
I don't know what you have, and then this device right here,
Yeah.
this little slider goes up and down this way. So what you do is, let's say this is your right, you can see the right heel.
Yes.
Right heel. So you put the right heel of the foot in here, and then obviously the toes will be in the front here.
Right.
Then you can read off the size, and then the size is facing you, right? Because you're supposed to read off the size, not the client, right? So that way the size that they are is actually facing you. It's not the one that's facing them.
Okay.
Okay?
Yeah.
So the number that's facing you is their size, and then obviously you can sometimes, if they have the toe and it's kind of sticking up, you want to push it down to make sure you can get a good reading.
Okay.
Then this little tool on the side is what you align with the big toe joint.
With the hallux. Okay.
Yeah, with the not with the hallux, but with the big toe joint. So the first metatarsal joint, right? So there's a big toe here, let's say, and this is the big toe joint. So when you pick up the toe, and you can actually pick it up, and you can see the joint break.
Yeah. Yeah.
That's where you want to align that tool, and it has a little center line right there. So that center line is going to kind of match up with where the toe breaks, and now you can read off the arch length on the side. So on this side, the size is facing you as well, and that's going to give you the arch length. So in some cases, great question, by the way, because that's going to explain a few things here as well. In some cases, somebody may have a longer arch length, but they may have a longer foot length, shorter foot length. Okay? So let's say they measure in the arch length, they measure in 9, but in the foot length, they're only in 8. Right? So now you would assume, okay, that's an 8.5 foot, but really what you want to do is you want to probably size them in a size 9 shoe, because that's going to match the arch length, and that's more important to match than the actual toe length, because then that's where the foot breaks. And then when you look at a shoe, you can see where that breaks right there.
Yes.
This point right here is the widest part of the shoe right there, where the big toe joint would sit.
Yes.
And this is where you want to line up the toe, right? So now if you go in a size 8 shoe, because you measured a size 8 in the toe length, right? Just assuming, now that's going to move back a little bit. But the actual arch length is longer, which means that he's like sitting up here with his arch length, right?
Yeah.
Or her arch length. And then this is where the shoe actually breaks. So now we're pushing that foot, forward in that area, which means that it's not flexing in the right spot. And then because the running shoe companies, nowadays are putting like crash pads and cushion pads into these areas where there's supposed to be more padding.
Yeah.
If you go with the wrong shoe length, because you're measuring based on the foot length, not the arch length, you end up with the foot not getting the full amount of padding that it should be getting, right? Because it's outside of that range where the padding is actually placed in the shoe. Does that make sense?
Yeah, yeah. So what about the measure on the right side of the device
On the
there?
right side, yeah. So this
Yeah.
part right here,
Yeah.
once you have the foot on there and you've moved it to the side and you bring it closer to the foot again. Now, once you have that measurement here for the arch length,
Yeah.
you then go onto this side over here, and
Yeah.
you find that size that you measured over here, right? And then there's going to be sizes along this line,
Okay.
which you can read off of. And then once you find the size here, and then this is basically the side of the outside of the foot right here is nice and snug there.
Okay.
Then you go down, and then you will find the actual width that this foot is.
Okay. So if I understand, when you're measuring the metatarsal joint of the great toe,
Yeah.
you're measuring the arch length, and that trumps the shoe size. Is that correct?
Yeah, I mean, unless the toe length is longer, then you have to fit for the toe length,
Okay. Okay.
right? Because I mean,
Okay.
let's say they have long toes but short arch. We can't really do much about that. You know, we have to fit the toes. You know,
Okay.
otherwise they're going to be scrunched all the time because we made the shoe too short. So we always have to go by the longer of the two sizes. But then you use this arch length that you measure on here, and you look at these numbers over here. They're
Yeah.
listed on the side. And then when you go down that line, which you find a number from the arch length, and you go down here, we'll have A, B, C, D, E, or maybe it has wide, medium, double wide.
Yes.
So we'll
Yes.
have numbers on the side, letters on the side. So that will
Okay.
give you the width of the shoe. But keep in mind
Okay.
that can vary. Because the width that they kind of portray here isn't necessarily taking into account how the width is measured in a shoe. It's more kind of a straight line. Whereas when you measure width for a shoe, we measure the girth. So that's the entire kind of circumference of the foot.
Okay.
And that's how manufacturers actually measure width, is the girth of the foot. It's not measured based on, a letter on the side here. I mean, that's just an approximation. And in some cases, it may appear to be wide, but the foot is super, super collapsed. So let's say it's a really flat foot. And in that way, the arch is dropping a lot, which causes the foot to potentially be really low in the shoe, and
Yes.
then therefore it slides past the front of the shoe right here because it's just sitting too low. So even though it may measure wide on the Brannock, it may actually be a medium fit or maybe even a narrow fit to make sure that it feels secure along the upper, right?
Okay.
We have to. I mean, some of the stuff we have to play around with, so it's not always 100%. But at least you can give him the foot length, right?
Yeah.
And then kind of check with their shoes and show them that hey, based on what you're buying, you're not having the proper fit in your footwear.
Well, that
and
was the
it's
point
causing a lot
when
of
I
problems.
picked that thing up. So, yeah, I thought it best to, I picked it up at a garage sale of all places. So it's a good score. I think I got it for $1 or something silly like that. So
Yeah, it's good.
Yeah, it was a good
pay
buy.
upwards of $100 for one of those when we buy
Oh,
it new.
really? More. Yeah.
That's a good deal. It's a good deal. But yeah, either way, I mean, with the Brannock device, it's a great device. And I think also a lot of times what I like to do is, like, if I can take the insole out of a shoe, because I see so many clients that wear shoes that are too small. And, oftentimes it's just a proper sizing in the shoe that makes all the difference for them. But we have to explain to them that, when you have a proper fitting shoe, it's going to feel looser than what you used to, right? Because most people squish their feet into tight shoes, and that's just kind of what they get used to. And then that's the way they continue to get, all these toe irritations because of the fact that they just don't have the right fitting shoe, right? So it doesn't matter if you treat them, they end up, right back where they started because of the fact that, they didn't change the footwear that they were using, right?
Right on.
Great question.
Great.
Any others?
Do you have any products that can be used to cushion the ankles or the back of the heel for someone who's stuck in bed?
To cushion the ankles?
Yeah.
No, I don't really carry anything like that.
Okay.
I
Does
mean,
Petty
there's
Fix
quite
make
a
anything
few
like that?
medical supply shops that would.
Yeah, does Petty Fix make anything like that?
There is some options, but most of that's for cushioning in a shoe, right? So if they're walking in the shoe and they have something rubbing on their Achilles, then there's pads for that.
Okay.
But that's more for footwear use, and that's not quite as heavy duty. Whereas for somebody that's bedridden, I would say it's probably you can get these not boot casts, but it's just like these kind of soft foamy things that you can put on to offload the back of the heel and stuff like that. But I would probably check somebody like Regency Medical Supplies or McDonald's Pharmacy. They would have something like that.
Okay, thank you.